This segment of Delmarva Life is brought to you by Delmarva Dental Services.
So we've been talking about headaches and migraines this week on Delmarva Life. We learned yesterday that certain foods like chocolate and even the weather might trigger migraine.
But there's something else that can cause them, and Jimmy, lucky me, I told you yesterday about how I occasionally get migraines. Well, I don't get them as much as I used to before I was diagnosed with something called TMJ.
Oh, really?
Yes, and I'm going to let Dr. Joe Harmon of Delmarva Dental Services say the actual name of TMJ because neither one of us can get it out correctly. What is TMJ?
Thanks for having me. Well, actually, TMJ stands for temporomandibular joint. It actually is the joint we have to talk about first. It's not really the disorder. Basically, temporo means temple, and this is the temple.
Right.
And mandibular or mandibula is the mandible.
Okay.
And the joint's here, so it's where the temple and the mandible meet is the temporomandibular joint. This joint, and we have two of them on each side.
So everybody has TMJ.
Everybody has TMJ.
Okay.
Everybody has it. It's like having sinus. If you have sinus problems, you say, I have sinus.
Everybody's got sinus.
Everybody's got sinuses.
Okay.
Or I have sugar, and when I have diabetes, I have sugar in the blood, but
So then we should properly call it
TMD.
Disorder.
Disorder, yeah.
But as we said, everybody has a TMJ, and there were two of them, and they have complex movements, right?
Yes, they do. It's really unique in that God gave us a very unique part of our body in that there's two joints, and all of our movements in our body are actually one joint. So we have two joints, and we have two sets of muscles. And the movements would be rotation, which is opening and closing.
Yeah.
And then there's gliding, which means that we can slide our jaw forward,
Right.
and we can slide it from side to side.
Okay.
So it's a really great complex muscle, but you can think about there's lots of things that if they have to go in unison, there's lots of things that could cause problems when two joints have to move in unison.
Okay, so let's say we've been diagnosed with TMD, the disorder. What's happening? What's going wrong here?
Well, you can have pain, you can have headaches, okay, and that's where your migraines come in, and you may have headaches in your temple area, okay. You also have pain in the joint itself, and it also can feel like there's pain in the ear, okay, because it's so close to the ear. Or you can also have pain in the muscles, the other muscles that control the jaw in the lower part of the face, and you can have limited opening. In other words, you can only open a little bit, or when you do open or bite, you have pain.
So is it safe to say that TMD is a malfunction of the TMJ?
No, because it could be just the joint would be TMJ, but it also could be the muscles.
Okay.
And that's where that comes in as well. It could be the muscles and it could be the joint both.
Does this apply to anybody and everybody? Can anybody get this? Is there an age range that you're more likely to get it than?
Well, just like any joint, the older you get, the joints wear out. In that respect, you're more likely to get it as you get older. Women tend to get it more frequently, but there's causes that can create the TMD problem.
Oh, so what causes it? You say women, we have stress, so is it that we're clamping down and?
Well, the main cause is injuries.
Okay.
Okay, just like any injury of your joint. Overextension, okay. You're open too wide, too long, which could be from a long dental procedure, like having your wisdom teeth out, or when you have general anesthesia and you have a tube placed down your throat into your lungs, and it's there for a long time, and you know it moves some, and when it moves, your jaw's moving. So when you come out of there, you could have a sore jaw. Usually your injuries will self-heal. Usually your traumatic injuries will self-heal. But there's other things that can cause problems too. There's arthritis, which is like any other joint that can cause a problem. There's things like an abnormal bite.
Is this something I could be causing myself?
Yeah, there's habits. For instance, think about your joint, okay? When does your jaw joint get to rest, okay? Your knee can rest, you can go to bed, okay? You swallow, every time you swallow, your joint moves.
Okay.
Every time you talk, your joint moves. Every time you eat, your joint moves. People that have abnormal habits, like grinding, or clenching, or
Biting your nails?
biting their nails, which makes, when you bite your nails, you bring your jaw forward, out of the socket and apply pressure. So you're not even applying the pressure in the proper direction.
Right.
So that can cause a problem as well, those abnormal habits. And the more you do them, the more that happens. Also your bite, if your bite's off, if your teeth aren't aligned, you bite the way you do because of the way your teeth are aligned. And if your teeth are aligned differently, you may have to bite where one jaw is out and one jaw is in. You may have to bite like this.
Just to get your teeth to settle
Just
in
to
right.
get them to come together adequately. So, but lots of people have abnormal bites, but you add the abnormal bite with the abnormal habits.
Okay.
And or an injury, and then you can have TMD.
And those are the things that you can fix with the abnormal bite with appliances
Yes.
and things like that.
Yes.
All right.
So is there some kind of treatment? Can we treat this somehow?
Well, the main treatment is just like any joint where you would rest, you apply ice or you apply heat depending upon the situation. Another treatment could be medicines like prescription medicines, painkillers,
Right.
anti-inflammatories, muscle relaxers. You can do relaxation techniques with physical therapy, biofeedback.
There's options.
There's all kinds
things.
of options.
Yeah, and also you could wear appliances
Right.
like a bite guard if you grind your teeth at night.
Right.
And that's kind of a preventative thing too. And that people that have recurring TMD problems may wear the bite guard at night all the time. Because remember I said when your bite is off and
Right.
you grind, it can cause more problems.
Yeah.
Your bite guard tricks your jaw into thinking you have a perfect bite.
There you
Because
go.
when you grind, you're not banging into teeth that you're not supposed to bang into. You also can use laser therapy, and that laser therapy will relax the jaw and stimulate healing. And Botox. If your muscle's in spasm, you can relax your jaw joint with Botox.
So many treatments, just consult with your dentist. Thank you so much,
Dr.
Dr. Joe Harmon.
Thank you. Great stuff.
And to read more from Delmarva Dental Services about TMJ and TMD, go to WBOC.com and click on our picture at the top of the page.